So this week I got a couple queries through my portal and through discovery calls, and a couple of them asked about multiple rounds of antibiotics. One was basically asking if I would be willing to prescribe multiple rounds of antibiotics for their family members, because apparently the person they're working with isn't willing to do that. The answer is no. It doesn't work, for one. And if it didn't work the first time, which only 1 out of 3 patients who use Rifaxamin or antibiotics will get a lasting result in their SIBO and IBS treatment. Second one was somebody who's interested in what I had to offer, but was like, I really want someone who can prescribe antibiotics because I think I'll need them. And to that I say, well, you've already had multiple rounds of antibiotics. You didn't get the result you wanted. If it wasn't going to work the first time, changing up the antibiotic and doing it again and again and again and again is not going to give you lasting results. It's just going to make you sicker because it's going to wipe out all your flora and really mess up your microbiome. We have better treatments now. High-dose sulfur has worked and really helped move the needle for 80% of my patients who do the treatment. And that, to me, that's people with complex, recurrent, really complicated situations, because that's basically what my practice is. I don't get the simple cases, generally. So the people with complicated issues are going to, come to someone like me who's a specialist in SIBO and IBS. So those people who have the really complex issues, they've done the antibiotics, they've done all the antimicrobials, they've done every herbal antimicrobial you can think of. There isn't a magic one out there. And then they're coming to me, and we're doing high-dose sulfur protocol right now. Not everybody's a little different, but a lot of my patients are. And we're moving the needle for the really tough cases. So I just wanted to speak that just because antibiotics are prescriptive and they're supposedly stronger, they're not a magic bullet. They're not going to wipe out your SIBO. They're not going to get rid of the problem. In fact, they're going to cause more problems. High-dose sulfur works better because it actually helps heal the connective tissue in your gut, restoring motility as well as restoring balance in the microbiome. So that's what I have to say about antibiotics, and I just thought I'd speak to that because I got 2 queries this week basically asking the same things. Will you prescribe antibiotics the way I want you to prescribe antibiotics? I'm like, the answer is no. So don't even bother with me on that. We get much better results using some of the newer treatments out there. And there's a whole lot of information on high-dose sulfur on GI Janelle's site. On her page, she goes into the weeds with the science. So antibiotics are not the way. And just because someone won't prescribe them doesn't mean they're a worse practitioner. But you do you. Make your own healthcare decisions. I'm all for people having autonomy around that. But when you're ready, reach out.